Hello and welcome. Today we're delving into the intricate world of the nervous system to understand a condition called autoimmune peripheral neuropathy. This complex disorder occurs when your body's own defense system mistakenly attacks the nerves outside of your brain and spinal cord, the peripheral nerves, disrupting their function and leading to a variety of challenging symptoms. So, what causes this autoimmune attack? While the exact trigger often remains a mystery, autoimmune peripheral neuropathy is believed to arise from a complex interplay of genetic predisposition and environmental factors. In some cases, it can be associated with underlying conditions such as infections like Campylobacter jejuni, which is linked to Guillain-Barré syndrome, or autoimmune diseases like lupus or rheumatoid arthritis. Certain cancers or blood disorders can also sometimes be associated, as can certain medications or vaccinations, although these are much less common. To understand the effects, we need to look at the nerve cell structure. Think of peripheral nerves like electrical wires that transmit signals between the brain and spinal cord to the rest of the body. In autoimmune peripheral neuropathy, the immune system mistakenly targets different parts of these nerves. This can include the myelin sheath, which insulates the nerve fiber and helps speed up signal transmission. When the myelin sheath is damaged, it's called demyelination. The immune system can also directly attack the nerve axon, which is the core of the nerve fiber that conducts the electrical impulse. It can also attack the node of Ranvier, where the axon is exposed. The nerve damage disrupts the transmission of signals, leading to the symptoms we'll discuss soon. Autoimmune peripheral neuropathy is relatively rare, but the exact prevalence is difficult to determine due to variations in diagnostic criteria and underreporting. Guillain-Barré syndrome is the most common acute autoimmune neuropathy, affecting an estimated 1 to 4 people per 100,000 each year. Chronic inflammatory demyelinating polyneuropathy, or CIDP, is less common, affecting around 1 to 9 people per 100,000. These conditions can affect people of all ages, genders, and ethnicities, with some types being more prevalent in certain age groups. The signs and symptoms of autoimmune peripheral neuropathy vary depending on the specific nerves affected and the extent of the damage. Common symptoms include numbness, tingling, and pain, often starting in the hands and feet and progressing upwards. Muscle weakness, loss of reflexes, and impaired balance and coordination are also common. In more severe cases, it can affect autonomic nerves, leading to issues with blood pressure, heart rate, digestion, and bladder or bowel function. The onset of symptoms can be rapid, as in Guillain-Barré syndrome, or gradual, as in CIDP. Diagnosing autoimmune peripheral neuropathy requires a thorough neurological examination, a detailed medical history, and a range of diagnostic tests. Nerve conduction studies are crucial to assess the function of the peripheral nerves and identify areas of damage. Electromyography, or EMG, measures the electrical activity of muscles to assess nerve involvement. Blood tests can help identify antibodies that are attacking the nerves. In some cases, a nerve biopsy may be necessary to examine the nerve tissue under a microscope and confirm the diagnosis. Autoimmune peripheral neuropathies can be classified into different types based on the pattern of nerve involvement, the rate of onset, and the specific antibodies involved. Guillain-Barré syndrome, or GBS, is an acute, rapidly progressing neuropathy often triggered by an infection. Chronic inflammatory demyelinating polyneuropathy, or CIDP, is a chronic, slowly progressing neuropathy that lasts for at least 8 weeks. Multifocal motor neuropathy primarily affects motor nerves and leads to muscle weakness, often in the hands and arms. There are also several less common types, each with its unique characteristics. The primary goal of treatment is to suppress the immune system and reduce inflammation to prevent further nerve damage and improve symptoms. Immunoglobulin therapy, or IVEG, involves injecting high doses of antibodies to help regulate the immune system. Plasma exchange, or plasmapheresis, removes harmful antibodies from the blood. Corticosteroids such as prednisone are often used to reduce inflammation. Other immunosuppressant drugs may also be used in some cases. Physical therapy and occupational therapy play a vital role in improving strength, mobility, and function. Unfortunately, there's no definitive way to prevent autoimmune peripheral neuropathy. However, avoiding known triggers, such as certain infections and medications, may help reduce the risk. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and avoiding smoking, can also support overall immune system health. If you experience any symptoms suggestive of peripheral neuropathy, it's essential to seek prompt medical attention for early diagnosis and treatment. The prognosis for autoimmune peripheral neuropathy varies depending on the specific type, the severity of the condition, and the individual's response to treatment. Many people with Guillain-Barré syndrome make a full recovery, although some may experience residual weakness or numbness. CDP is a chronic condition that requires ongoing management, but with appropriate treatment, many people can maintain a good quality of life. Recent research has focused on identifying new therapeutic targets and developing more effective treatments. Studies are investigating novel immunosuppressant drugs, targeted therapies, and regenerative approaches to promote nerve repair and recovery. By understanding the intricacies of this disease, we can strive to improve the lives of those affected and offer hope for a better future.